So thank you very much for organizing this meeting. I'm quite honored to speak at such a meeting about a problem that is common to our country, so the access for our patients to clinical trials. My name is Dorica Dan, and I'm representing patients with rare disease in Romania and also patients with rare cancer. I'm the president of Romanian Prader-Willi Association, Romanian National Alliance for Rare Disease, and Romanian Association for Rare Cancer. And since 2011, we opened in our city in Zalău, Neuro Center, which is a pilot reference center for rare disease, which was accredited by Ministry of Health as a center of expertise. And together with 4 genetic centers, it became one of the healthcare providers in ERN Ithaca. So I'm really happy to speak about clinical trials and more about the clinical trials and the situation today in Romania. So enrolling patients in clinical trials is a major benefit as patients' access is higher. They have access to quality treatment. It's close. They are close to the medical staff. They discover new diseases if it is the case, and they have the chance to have a prolonged life. In addition, this brings benefits also to the investigators and to the healthcare providers and healthcare system. Starting from January 2022, Romania, together with 29 countries from CE countries, is a part of the joint European platform for running clinical trials for human medicines in the European Union and European Economic Area. According to this data, approximately 4,000 clinical trials are authorized each year in Europe, and approximately 60% of the clinical trials are sponsored by the pharmaceutical industry, while 40% of them are sponsored by non-commercial sponsors, mainly academia and research projects. The situation in Romania is not very good, and it was worsening years by years. And we don't have very sure data, but we did our best to search and to find more information for this meeting today. So in August 2022, 45 clinical trials are authorized and ongoing in Romania, and 56 clinical trials are under evaluation. 4 requests are even under evaluation since 2020. All the authorized clinical trials are running in medical units in Romania, and they are in phase 2 or in phase 3. Out of the first 45 authorized clinical trials, 16 are for cancers, and some of them are for rare disease and rare cancers, but we don't have the exact number. Patients may identify the authorized medical centers to run clinical trials for various pathologies, while the decision to include them into one clinical trials belong to the investigator and the medical doctors based on strict criteria. All the data are from the National Drug Agency website. During the years, the situation of the clinical trials was worsening, as I said before, and Romania's performance in attracting clinical trials has been on a downward trend. The number of clinical trials drastically decreased since 2008. According to IQVIA reports for RP, we can say that in 2004 we had 125 clinical trials, while in 2008 we have 408 clinical trials per year. Then in 2012 we had only 221. And in 2016, the number decreased to 200, and in 2020, we had only 157. This situation was very bad because the problem is that the states or the countries that need more clinical trials have less access to clinical trials. If you look at the situation in Europe, for instance, in Great Britain, they had in 2019 1,407 clinical trials. In Germany, they have 1,073 clinical trials. Belgium had 651. Poland had 419. Czech Republic had 241. Hungary had 207. And Bulgaria 108, while Romania had only 98 clinical trials developed. So Romania lags behind a smaller country like Bulgaria or Hungary, and we can't even dare to compare with France or UK or other countries. And according to this survey, the key barrier in the development of clinical trials market in Romania is the long timelines in regulatory authority approval process. So in Romania, we have a legal time frame for this of 60 days, but the average delay was to 301 days in 2019. So 5 times more than the legal time framework. So there are many challenges with clinical trials in Romania, and National Drug Agency says that extended timeline for the approval process is the main barrier in the development of the clinical trials. But patient association consider that the key barriers are bureaucracy and lack of reforms for improving the authorization process, low transparency for patients in relations with clinical trials, low communication, lack of transparency related to the clinical trials, and lack of stimulating the doctors to promote and engage in clinical trials. Member states or national authorities should consider clinical trials as an investment, because a quarter of the clinical studies market goes to the state budget. So for each 1 million euros that's spent in a clinical trial, the budget of the state received 270,000 euros. So it's not for free. So the state earned money from clinical trials, but they do not consider clinical trials as an investment to improve the situation, or this situation in Romania. So, for instance, in 2019, the clinical trials contribution in Romania was 19.8 million euro, and from this 5.3 million was savings in oncology, and 1,760 patients were treated in clinical trials in 2019, with an average cost per patient of 3,021 euros. So it's very important for patients to have access to clinical trials, but also for the healthcare system. Then for patients with cardiovascular disease, we had 2,783 patients in clinical trials in 2019, and the average cost per patient was 1,482 euros. Also, 6,561 patients benefited from free investigations, because we know that in our country, sometimes patients have access to national programs for the treatment, the basic treatment for their disease, but not always they have allocated funds for monitoring the patients or for different investigation that they have to do in time. So the evolution in Romania, according to the IQVIA report recommendations, should simplify the approval procedures for clinical trials. This way would consolidate the resources of the National Drug Agency. Then we need to increase transparency and communications, and for these patients would have easier access to the authorized clinical trials, and to increase the capacity of the site, and to have dedicated units for running clinical trials in Romania. All this would contribute to transparency for patients, more information related to clinical trials and the process for the patients in a simple way and understandable way for patients. And this way would be our country would be connected with CE networks. This is what we hope from the new legislations on clinical trial from this year. So we have a huge potential for developing clinical trials, and we should change from the very low interest in and low level of involvement in approval process for a national drug agency we should change to a very attractive for clinical trials, and try to become attractive for clinical trials, because we would have access to quality data, to a legal framework, and clinical trials benefits. Unfortunately, as I said, in our countries, we have a big number of patients with severe diseases that could be eligible for clinical trials. But because of the barriers, they could not have access. For instance, in oncology, we have an incidence of in Romania of 4,173 patients at 1 million inhabitants, while the rate in Europe is 4,990 to 1 million inhabitants. In cardiovascular disease, we have an incidence of 6,652 patients at 1 million inhabitants, while in Europe it is lower. It's 6,040 patients to 1 million inhabitants. In tuberculosis, the incidence rate in Romania is 650, while in Europe is 350. And only 5% of the patients with rare disease have a diagnosis in Romania, mainly because a large number of population is living in rural areas without access to infrastructure and proper care. And sometimes because of the poverty, they don't even dare to address to a doctor in a university city. Romania has one of the highest incident rates of the cervical cancer in Europe, and prevalence of hepatitis B is one of the highest in Europe. So in conclusion, we can say that our perspectives are that according to the new legislation and with the enforcement of the European Clinical Trials Directive, we hope in improvement of the flow of information between all parties, clinical trial sponsors, European Union, member state, European Economic Area, countries, and European Commission. We hope that this collaboration will improve the access for patients with rare disease to clinical trials. Also, we hope that transparency, which is a major feature on the searchable public platform, with detailed information on the outcomes of all clinical trials which are authorized and are in this platform, will help patients to be oriented to the proper clinical trial. And also, we hope that with this new legislation, the member states, and including our national authorities, will involve more to remove the barriers and to bridge the gaps in order to ensure a better access to clinical trials for patients with rare disease. So I would conclude that the new legislation is helping us to keep our faith and hope that patients with rare disease in Europe. Thank you very much for your invitation.